So welcome everybody. We're super excited for you to watch this recording of our talk. Today we're going to be covering COVID care, self-care during the COVID-19 pandemic. Next slide. We're really grateful for the co-sponsorship of the program committee and also the wellness committee. We want to emphasize that the idea of this talk is to also focus on ourselves, taking care of ourselves, just as we're trying to take care of everybody else in order to prevent this parallel pandemic that people are forecasting because of the impact of COVID. Next slide. So it's important to start this talk at the outset with normalizing beliefs and what we perceive is our worth. While loyalty and identifying with your work provide a compass, we must also respect the boundaries between work and our home life. In fact, an important and often overlooked is the part of self-care is knowing when and how to set boundaries. And so by setting boundaries and value alignments, we are steps further in truly experiencing this idea of work-life balance or work-life integration. Next slide. And we must take into account the time and effort to cultivate each of these areas of our lives, because the grass is always greenest where you water it. And we hope that part of your focus is also to fill up the other things besides work that means a lot to you, including your friends, your family, as well as taking care of yourself. Next slide. So what is this work-life integration? What is that idea? How is that different from work-life balance? And so why not just call it life? It's like some people have suggested that. Next slide. Work-life balance puts work and life at odds. That is, the term highlights this tension wherein focusing on one is unfortunately at the cost of another. So when you're focusing in your life, your work suffers, and vice versa. When you're focusing on your work, your life suffers.
So the problem during the last year is it's been a lonely, overwhelming situation that has all of us struggling with the weight of what we see and deal with every day, as well as the normal everyday things that make up life. As a result, we have emergency physicians dealing with increased depression, anxiety, and sleep disturbances. And then emergency physicians are suffering more than they usually do. We hope that by talking about the various areas that we're suffering in and ways to overcome some of these difficulties will help physicians perform better self-care during these continued COVID times.
So a way to look at work-life integration is to understand its different components. The book Designing Your Life uses tank gauges or levers as a way to visualize these components. They broke it down into health, work, love, and play, instead of simply just work and life. And each of us can look at our own life and reflect on how full our tank is for each of these domains. And so for the remaining of this talk, we'll focus on love, our high quality connections, as well as different aspects of this. And so to start us off, next slide.
So for the rest of the talk, we're going to divide self-care up into these 5 sections, where we divide health up into physical health and mental health, and then work, love and high-level connections, and play. During each section, 2 of our speakers will speak about the problem within that area and thoughts on how they deal with those problems. While they are speaking, we ask that you put in the chat any thoughts you have about how you're dealing with the struggles in that area. Another of our speakers will then collect those and discuss those at the end of the section. So we'll start with mental health.
By the way, we forgot to, sorry, Olivia, we forgot to introduce ourselves. So when we're presenting our small topics, we will just introduce ourselves there. Go ahead.
Hi, Olivia Bailey. I'm one of the APDs from University of Iowa. Burnout in emergency medicine was already a problem, and then came COVID, bringing additional stress to our professional and personal lives. As mentioned earlier, a study revealed that healthcare workers, there was up to 51% more depression than expected. And similarly, there was up to 45% more anxiety than expected. Up to a third of healthcare workers had evidence of sleep disturbances, although honestly, I would wonder if it'd be higher than that. An ASAP poll showed 70% of EM physicians were experiencing professional burnout due to COVID-19. And an article in the Annals of Emergency Medicine demonstrated 1 out of 5 ED personnel screened positive for PTSD risk. Compounding all of this is the reluctance to seek mental health treatment due to stigma or concerns that it will impact a physician's license. We dealt with the uncertainty as the pandemic began, and then COVID really became all consuming. We spent hours of our free time trying to absorb all the information we could, some scientific, a lot of it speculative, just trying to learn how to treat our patients with COVID. And we also worried that we were going to bring COVID home to our loved ones. Some healthcare workers lived apart from their families for this very reason. While many of us took every precaution possible, some family members, friends, and acquaintances carried on with life more similar to normal. School-aged children remained at home. Parents became teachers. Finding time to take a break or even a pause became very difficult. We were left exhausted and overwhelmed. This stress has been chronic, long-term, and for some debilitating. There's been very little reprieve, although with the vaccines, there's been some hope. So we've got some suggestions on ways to promote our mental health in general, and especially during challenging times such as this.
Thanks, Olivia. I'm Michelle Lal. I'm an associate professor at Emory University, and I am also our department's director of well-being, equity, diversity, and inclusion. So a couple things to think about and a couple general practices that I'm sure we've all heard before, but really have found to improve scores not only in depression and anxiety, but also in PTSD. So I want to talk briefly about mindfulness and then about gratitude. So mindfulness, right? It's this sensation of being present. So it's the quality or state of being consciously aware of something. So living in the moment, being a part of the moment. So there's a lot of different practices that you can undertake to improve your mindfulness. Some of the ones you are probably most familiar with would include meditation, right? And meditation can come in many different forms. For those of us who have an attention span that's very, very short, there are actually some like 60-second meditations that you can do. There are meditations that can be done standing up. So, and these can even be done at work if needed, but it's a practice where perhaps you stand outside the patient's room. You take a moment to feel your feet in your shoes on the floor, the sensation of the solidity of the floor below you, and then that sensation traveling up your body. Perhaps you're going to wash your hands at the sink, or you're going to use the hand sanitizer, and you're going to feel the water or the foam on your hands and appreciate those sensations. And then perhaps you're going to take a deep breath, or maybe several, before you go into the room so that you can recenter yourself to give the patient the attention that they deserve. Other forms of meditation include combat breathing, which is practiced in the military, but in other places. And this is the concept of really controlling your breath, being mindful of your breath. So we're talking about, an inhalation of 4 seconds, a hold for 4 seconds, and an exhalation for 4 seconds. And even just focusing yourself on your breathing to that extent can really help to relax and calm your mind. So really the point of mindfulness in large part is to kind of stop and literally smell the flowers. Take the moment that you're in and take some appreciation from it. The other strategy that works quite well is gratitude. So there are many different ways to express and show gratitude. I have many colleagues and peers that journal in a gratitude journal, and they try to start their day or end their day with one thing that they are grateful for in their day. Several years ago, there was a big study at Duke, and Duke actually has a whole gratitude center now that you can look and read a ton more about online. They have different modules, but this whole project surrounded on this idea of talking about 3 good things. And physicians were asked to journal about 3 good things at the end of their day, but they had to use the following words. So joy, gratitude, serenity, interest, hope, pride, amusement, inspiration, awe, and love. And what they found in this study is that they actually were able to sustain lower burnout scores in physicians from baseline, both very short term at 1 month as well as longer term. So there is something to be said for taking the time to have some gratitude in your day and thinking about something that you may have had experienced that day, seen that day, or something that you can recenter yourself with at the end of your day.
Since we don't have an audience and nobody's entered anything into the chat, I'm just going to move on to the next section if everybody's okay with that.
Fantastic.
So physical health. This ties closely into mental health, and that can be seen by the fact that Olivia mentioned the sleep disturbances that people are experiencing more than usual. That has huge impacts on physical health, and you see it in the weight gain and the lack of exercise and poor nutrition and just the overall exhaustion that in general we're all dealing with. The kind of joke is that we've all gained a ton of weight, and in reality it's like the Renaissance after the plague. At that point everybody was overweight and fluffy, and people, that was idealized because finally you had a situation where it was you weren't in scarcity any longer. So I think all of us have suffered, whether it's weight gain or weight loss, lack of sleep, need to take more water, better food, any of that, need to take medicines of some sort after all of the physical health. And then that doesn't include the folks that have actually suffered from COVID and are suffering from side effects and long-term effects of COVID. By the way, I'm Christine Stamen. I'm at UIC Peoria and OSF Healthcare. And I'd like invite Mandy to talk a little bit about some of the physical health problems that she's dealt with during this time.
Hello, everyone. I'm Amanda Ritchie. I'm actually an incoming IMEM intern at LSU New Orleans. So like everyone else in the transition from being a medical student, getting ready to start intern year, all the changes, the physics saying an object in motion is going to stay in motion. And one of the hardest things that have happened this year is that the gyms are closed. You can't really get the workout that you really want to anymore. And so one of the things that I've done is used my home gym that I've actually built here. So I have a Peloton bike, and one of the things I really like to do was get on that bike, because when I am moving, when I am burning off that kind of energy that I really need to just kind of get out of my own head, I start to feel better. And then the more I worked out, the better I felt. So I wanted to work out more just to kind of give myself that little bit of endorphin boost. And there's so many things, whether you have a home gym or not. If you want to go hiking on the trails, absolutely go hiking on the trails. You never know what you're going to see out there. My husband and I went walking, and we saw a herd of white-tailed deer and a coyote sunning himself on, a little hill. So of course, that's the time you forget your camera, right? Can't capture that in film. So, I've focused on remembering that memory because it brings a smile to my face even now that, I got to connect with nature in some way. Whether you can go swimming if you live by the ocean, if you're in a northern area like me, you can go snowshoeing. So there's so many different avenues that you don't need a gym for, where you can still kind of get that physical activity. Christine, do you have any other suggestions?
Right. I mean, like you, I am part of the Peloton community, and I think that's the biggest thing, is that this, even though we didn't have the gyms, you had ways like Peloton, NordicChack, and all the other things virtually. A lot of the gyms, smaller gyms, put together ways that you could do classes virtually, so you could still interact with people and still have that accountability, because I think that's part of it, and it connects with something we'll talk about later when we talk on love and connections. But some of it wasn't just working out, some of it was the ability to be around people. But I think a lot of people did build a home gym, did find challenges to eat a little bit better, to say, okay, I'm going to try a new food every day, or get out in the sun for 15 minutes a day. And I think that's one of the biggest things, is to try and keep moving, because even though you want to go to sleep, sometimes actually getting moving will actually make you feel better. And that's I think the biggest, you feel one way and it actually, you need the other one. And I'm having a brain fart on what the right word is, so I apologize. But hey, it's been a long couple days, right? But
hey,
I did
self-compassion, right?
Yes. So, okay, let's move on to the next section, which is work.
Okay, so work health. Man, this has been a rough 14 months to probably have any kind of health at work, and as Olivia had mentioned previously, certainly pre-vaccination, we were all so on edge, and to watch your colleagues get ill, some of them critically ill and some of them pass away, was just heart-wrenching. And the concern for bringing COVID home to your family, so many concerns, so many things to be thinking about that we weren't routinely thinking about before, or at least I wasn't. And certainly a bit of a reprieve with the vaccine, but certainly again, that kind of depends on your local climate as to how many patients, how many people in the community are getting vaccinated and how many patients with COVID you are still seeing. Where I am, we still have more hospitalized currently than at our lowest point in the fall. So it's definitely not gone. So I think a couple things to think about in terms of work health. I think number one is just the overload. I mean, there was just too much. It was too much stimuli pulling your attention everywhere. There was cognitive overload. Did I get an email today that told me how a policy had changed yet again? Sort of this like emotional overload. Is there enough PPE? Do I really have to rewear this? Is it safe for me to take my mask off for 10 seconds to drink some water? Really a lot of challenges I think that we had not faced before. In addition to that, the staffing issues. I mean, the nurse attrition in so many hospitals was enormous, and nurses moving to areas where, they could be COVID nurses and be paid incredibly well, but, left a lot of our EDs either short-staffed or filled with traveling nurses or nurses that were relatively inexperienced. And then, having colleagues go out on leave, and early on in the pandemic, when we didn't know how long people needed to quarantine and what things meant, I mean, that was a significant burden on the schedule to have several providers out at one time. And then I think just the burden of caring for these patients. I mean, this was awful. We were watching people that were actively dying in front of us, knowing that we were going to intubate them, that they may never get off a ventilator, they may never talk to their family members again, trying to do FaceTime or other things so family could physically see their loved ones. And that was just horrible. And I think, sitting with the dying, which I think we were all asked to do far more than I've ever been asked to do previously in my career, takes such a great emotional toll. And I think this is where, health at work really bleeds into life. And this was probably the first time for me in a long time where, I hadn't drank both my water bottles at work. I didn't take my mask off to eat because I was scared. I didn't know what was going to happen. And, certainly put us all in physical health, poor states to go so long without eating or drinking, and, whatever bad habits then happen when you get home. And I think now, our work health is still, I think, in jeopardy. I think we all probably have a component of PTSD, whether we recognize it or not. Things are not back to normal. We're still in this prolonged recovery phase. And I'm not sure that we've all taken the time just yet to really sit back and reflect on what we've seen, and allowing ourselves the time to process through these experiences, because we know if we just shut them away, they're going to come back. And I think we really, as an emergency medicine community, need to focus on how do we process what we experienced and how do we move forward.
So along those lines, we talked about some ways that we can do it. Obviously, when the pandemic started, we had a lot of morale boosting events where the local communities brought us food and drinks, and were super supportive, like the 7 p.m. claps and honks and everything like that. And of course, that's died down, even though COVID hasn't. We still get some morale boosting events, but maybe the organizations need to start doing some of those morale boosting events. Weirdly enough, Nurses Week at my hospital became Healthcare Providers Week, which is the first time ever I think I've seen Nurses Week get taken over by everybody else rather than the other way around. So doing some of those morale boosting events, whether it's mask giveaways, the continued food deliveries, but more importantly, based on what Michelle was mentioning, is the team debriefs. Whether it's a patient that had something that you didn't expect them to have, a patient you didn't have time for, a patient that came in really sick, and taking those times to really debrief it, whether it's, and it may be something simple, like a little kid who had a supracondylar fracture. It's the first one you've seen in a while, or the trifecta of them like we had last night. So taking the time to debrief how you feel about that and what you need to address, and how those things are affecting your colleagues. Other ones you can do is, one of the things that all of us have suffered from is we really haven't gotten to connect with our friends and family recently. So, but there's times when you're going to be fully PPE'd up. And if you guys are in that place and everybody's comfortable with it, do a full PPE hug. It's a pretty safe thing to do now, right? Because you're all covered up, assuming, right before you go in and do a code, like you're waiting for the ambulance to come in. Also, taking the time to step away, right? Whether it's to run up to the cafeteria to grab some food, to actually pee, or to get a little bit of fresh air. Take that time to reset yourself, because sometimes you get a little discombobulated with everything that's going on and you need that moment, and you're not going to get it if somebody's shoving an EKG in your face or asking you to take a telecall, or a resident wants to present to you, or anything like that. And then finally, take some time to make sure that everybody gets a chance to do something different, whether it's take a picture of something on your little break off and show it to everybody, something that made you happy, or making sure that everybody teaches somebody else something non-medical. I can't tell you the number of conversations I've had about various TV shows that all of us have had the opportunity to watch during the pandemic, and learning about new ones or new books to read or things like that. But it definitely brightens the day on a long shift when you have, especially if you're in a COVID pod and have a lot of COVID patients, with everything going on. So I'm going to hand it off to the Love and Connection crew.
So the pandemic also brought the challenge of social isolation to so many. And, the typical ways we would connect with others, going to restaurants, concerts, going out after a shift to get food, family holidays, etc., they all went away at once. And for those with roommates or maybe household family members, there was some continued in-person connections, but for many, this was not the case. And I especially think of our interns who maybe moved to new cities and didn't have a connection locally yet.
Yeah, again, my name is Eli Alvarez. I'm one of the APDs here at Stanford. To me, this was the most difficult issue with COVID, and I'm not sure we ever really came up with a perfect solution. Many people cope and find support through their peers, faculty, co-residents, friends, and family, as Christine and Michelle had alluded to. But COVID took so much of that away time that we needed to really support each other when we really needed it the most. So specifically, it was most challenging for those new in the departments, as Olivia was mentioning, including new faculty, new interns who didn't really have any bond or network in their new departments. And so I think this is very important to consider in your work and also wherever you're at.
Communication is one way to a deeper connection. Without connection, we begin to worry about becoming isolated and we go into fight or flight mode. Increasing communication can happen through a variety of ways, all of which we've probably become familiar with during the pandemic: video chats, FaceTime, Zoom, phone calls, messages. You could also have safe outdoor distance activities as well as Zoom happy hours.
I love that. Yes, my cousins actually devised this Zoom bingo event with all my aunts and my cousins during Mother's Day. And so it was really a blast. Like, who knew doing bingo on Zoom is a thing, and that our loved ones would actually be enjoying it. At LEM, we had a musician show up during our Wi-Fi and Y events. And he just played show tunes and played 90s music for an hour. And so karaoke style, people were singing. And so again, it just made that connection even stronger for us. And so I've since gotten this musician to even come to family events, and you'd be very surprised. They're actually very reasonably priced. Here's another way of deepening connection. So implementing an adopt an intern or adopt a resident, especially during the holidays, create another way of developing bonds with someone that you may not normally interface with as much as your doing now, especially during the pandemic. So it's a great way to integrate new members to the department and then make them feel welcome.
I have a group of friends from medical school, and we travel together every year. Of course, we were unable to this past year, but we also had kind of a Zoom game afternoon. And this was fun for us because we were able to include our kids, our significant others, and that's not typically what we've been able to do when we travel. So it was a meaningful new way to connect.
Yeah, I love the idea of travel, and we'll definitely talk about this when we get to the play part. But road trips, local places, national parks, forest bathing. Amanda earlier was mentioning about like going to the woods. There's a lot of benefits for this, and something that we can definitely take the time. As Michelle mentioned earlier, that mindfulness practice, right? Like being present and really enjoying each of these moments that we have with each other, as opposed to sometimes there's this like, okay, I gotta like catch up with you, so let's just talk right now, and not really experiencing and being there and really connecting. And so slowing things down will allow you to just remember that we have so much to be grateful for as well.
Couples or friends from far away could take cooking classes together with famous chefs, or I did a wine tasting with a sommelier. For someone in Iowa, these are really great opportunities that we don't always get kind of locally.
Yeah, definitely. There's lots of CME for things that I normally would not have spent money on. I took a class on mindfulness, another one on design thinking. Earlier, we were discussing about trying to catch up to all of these SAM meetings that we've missed because we had to go to so many other ones. So I think finding just time for ourselves and really making sure that we're also acknowledging that we can't be in so many places at once.
My family got a puppy, which I swore we would never do because we were home enough, but then COVID happened. So we got the dog, and it's been actually really wonderful for the whole family, meaningful connections, and we've taken family dog walks. It's really been something impactful to our lives.
Yeah, in our department at Sanford, for the winter holidays, we got like a bulb of tulips for our gifts, and so we all planted it at home. They gave us this kit thing, and then we had to like take pictures like every week or so. And it was something that kind of connected us. That like now there's this plant that's growing. You get the beautiful flowers like weeks later, and surprisingly, mine is even still thriving.
WhatsApp proved to be a great way to stay in touch with family and friends spread geographically apart.
And I love this idea of reaching out to family and friends using different social media platforms. I know that it's been shown to also kind of add more stress because really what people are portraying in social media may not be the most accurate. But even right now, right? So let's try this. At this moment, each of you can just take a pause, grab your phone, right? And reach out to somebody. And this goes with the idea that Michelle was telling us earlier about gratitude. Send a text message or a direct message to a family, a friend, and say thank you or something that you're grateful for. I'm going to pause here for us to do that right now. And again, it may not be somebody that you talk to regularly, or it could be somebody that you talk to all the time. And again, how did that feel? Because did you know that practicing, as Michelle was referring to earlier, practicing the 3 good things or sharing 3 things that you're grateful for each day for 2 weeks has been shown to be better than an antidepressant in 6 months, according to one of the studies. And so a simple gesture of authentic expression of gratitude has great benefits for you and also for that one person that's receiving that gratitude text that you just sent. And I guarantee you'll make that person smile as well.
Physicians found increased time with family as a result of being home more. Kids' activities were canceled, school was canceled. This family time during the pandemic really has been described as a gift, and I would agree for many physicians, and it's something we've always kind of wanted, and then we got it. And these meaningful interactions between family members play an important part in our well-being.
Yeah, for me, another thing that really has been a great help is DoorDash and one of those delivery apps. DoorDash just definitely has become my friend. It's allowed me to send dinners and lunches to family members far away, right? So food has a way of connecting people. I do this at work. I bring prepackaged snacks for the residents and nurses and my co-faculty, and because it breaks that monotony of the face masks and the goggles, and it allows for those moments to simply connect. You can chat about the particular food that's in front of us, or to simply just check in with each other. Lastly, either when zooming in or meeting in a meeting or meeting a friend, consider sharing something more vulnerable. This goes beyond just the superficial interactions that you're getting. And so one suggestion that I learned from the performance coach of the Boston Red Sox is the idea of the 4 H's. So the 4 H's is hero, hardship, a highlight in your life, or something that you're hoping for. And the idea is you spend a few minutes at the beginning of meetings as a ritual to develop this high quality connections. And this, again, the idea is to promote better teamwork. High quality connections has been shown to increase creativity and innovation. And so you can also do airway series to use narrative medicine, similar to our workshop yesterday at the storytelling events. Sharing our narratives can be powerful because these emotional stories humanize us, as opposed to simply just showing up to work again.
We suggest continuing to use virtual platforms to connect with each other. If you're feeling zoomed out, try a different platform. Use your phone and make a call, or even send a postcard or letters in order to maintain connections.
And so we're going to jump into play following this. And I think this is one of my favorite part of this levers, because it normalizes that I should play and I should embrace my inner child. And each of you should look into yourself as well and see, like, what were those hobbies that really make you enjoy what you're doing? This idea of promoting well-being through creativity and play is very, very important. And unfortunately, there's this scarcity of time, there's a scarcity of attention, and we don't really have a way to do this and manage ourselves because of the pandemic, because of all the expectations, until you realize that there are actually a lot of things in front of us, like our calendar. Mandy, what do you think?
You know what? I really agree. And I think one of the hardest parts about this pandemic has been trying to keep up with my sense of play, because it felt like there was nothing to do. Everything was closed. Everyone was isolating. There was no chance to do something for fun, simply for the fun of doing it, which is what play activities are about. Exactly like you said, embrace that inner child, do something fun, make yourself smile. So for many fourth year students, like myself, who were, going through the match process, getting ready to transition, I can't imagine what it would have been like last year, knowing that you were moving and how daunting it would have been to have to move to a new city where you didn't know anyone. You don't know the culture. You don't know what's there. You don't even know your way around the city. So you don't even know who to ask. So it's definitely been, a year of a hard time finding that play modality.
Yeah, and that's a good point. So we know that we have hobbies. We know that we can kind of reach into our inner childhood and see what makes us happy. I think one key thing is that including these non-work related activities in your calendar will brighten your outlook, right? Now you can actually, instead of like, oh, I have a bunch of Zoom meetings, include things there that would make you enjoy your day, like cooking or any of those activities that you were listing. The examples that we've covered so far here are much more attainable if you can integrate them in your work week and you put them in your calendar, because then it gives you permission to actually take the time and take care of yourself. Taking vacation is also an important aspect of work-life integration. Time away helps us process our experiences. It also gives us time to replenish this energy in our commitment to our work. According to one study, while the average life satisfaction did not really change during vacation, 5 weeks after vacation, the subjects still reported less physical complaints than before going on vacation. The experienced recuperation during vacation explained more than half of the improvement in their well-being. So it's not just like the time away and that break. It was actually that being present in those vacations that was also helpful. And so I hope I don't need to convince you that vacation is important. Therefore, we should discourage people to buy vacation times back for unused vacation. But unfortunately, in the US, for instance, more than 55% or more than half or 55% of the workers reported that they do not use all of their allotted time each year, which is very sad, right? Like in the US, people are actually more likely to just do more work simply because they can. And so just because you can work more does not mean that you actually should. And so for those who actually go on vacation, it's also very important to really emphasize unplugging. Literally, like some people would turn off their emails or find ways to like manage that ahead of time. So set up those auto reply that say, hey, I'm taking time for myself. I'm going on vacation. You should too. There's something to that effect that normalizes vacation, because especially I think during the pandemic, it's as if we're embarrassed to acknowledge, or there's a shame involved when we're taking time for ourselves when we go on these vacations.
So one thing that I'm really happy about that I was able to do because of COVID is get back to old hobbies. So kind of like a staycation, didn't go anywhere, stayed in my own house, but went back to things that I've really enjoyed that I got away from during med school, during, the match process. And I never felt like I had time to do them. I have a library full of books that I never opened. They were full of dust, dusted them off, got back into reading, and I forgot how much I enjoy reading. I decided to pick up knitting again, and I started to knit a color blanket where I had a temperature chart and a color of yarn that went with the temperature of that day, and one row per day of the year. And when I'm knitting, it brings me back into the present. It brings me back into the here and now instead of the 8 million things I feel like I have on my to-do list. So being Canadian, there's a lot of blues and purples on that blanket and very few oranges and reds. But you know what? Seeing those colors get knit together, it was awesome.
Yeah, the more you can hone your ability to be mindful and being present, the better you can get more out of these experiences, as Michelle was referring to earlier. Practice searching for moments of awe as well, right? So the shadows changing shapes on the cliffs at Bryce Canyon during sunset, if you're going on a road trip, any sunsets in general, and maybe like dolphins, like if you like scuba diving, like think of something that like spending more time like in the water. And again, these are tougher during the pandemic, but you'll find your way to really replenish your energy when you are really committed to taking vacation. Vacation experiences, especially pleasure, relaxation, savoring, and control, seem to be especially important for the strength and persistence of vacation. So when they did that study, like those experiences like of relaxation, savoring, and control have more meaning weeks and weeks later.
Exactly. And I mean, as it's already been mentioned, food brings people together, whether, you're having a celebrity chef kind of cook in, teaching you how to do something, or whether you're sending food through Skip the Dishes, or you're trying out a recipe on your own, all these opportunities bring people together. So, if you want to try a new recipe with a friend, but you're still in isolation, pull out that beef bourguignon or laksa recipe, try it out, do a Zoom cookout, where you and, another couple are cooking on the other side of the screen, and then eat together. You're still having dinner together. You're just not, in the same room. So it gives more options and kind of breaks up the monotony of, sitting at the same table with the same person day in and day out.
All right, Christine, take it away.
I think you had actually put this together.
Oh, yeah. I thought you were going to summarize further. I can go over this. So if we're never satisfied with our contributions in our work, we'll soon realize that there's always something more that we can do. And so we hope that you're able to find ways to fill up your tank as you pursue contentment and work-life integration. Next slide. And we'll end with this quote by Viktor Frankl's book, Man's Search for Meaning. Happiness cannot be pursued. It must ensue. And so each of us has the capacity to design environments that foster contentment and will help fill up our mental health, physical health, work, love, and play levers. And again, thank you so much for watching our talk. And we hope that you can add more to this, and feel free to engage us in social media. And also we'll give you some the links for our email addresses if you have any questions.